I had cried my heart out before getting the diagnosis because I knew deep down that we were dealing with something very serious. Our house alarm went off and Neave was fast asleep and she just slept through it. I didn't have the severe hearing loss or the profound hearing loss name, but I could tell that we were dealing with a problem with her hearing, and that was very, very scary. How we found out about Neave's possible hearing loss, we had a routine test at the hospital 2 days after she was born. We were referred to the Karel du Toit Centre and the Tygerberg Hospital Cochlear Implant Unit, and Dr. Wachenfeld is the head of that unit and was the first doctor to do cochlear implants in South Africa.
Patients who have damage to those little hair cells in the cochlea can't be helped by hearing aids. They need something else to stimulate the nerves directly, and that's what a cochlear implant does. It stimulates the nerve endings directly with an electric current.
There was good and bad news from Dr. Wachenfeld. The good news was she was structurally a candidate for a cochlear implant, which was a huge relief. But the bad news was there was inflammation in her cochlea, which indicated an infection in utero, that Dr. Wachenfeld needed to operate unusually early on Neave.
Through our experience, we've learned that the ideal time to operate these children is sometime between the age of 6 months and 2 years, because then they can still develop their communication skills normally. However, Neave's case was different because she ran the risk of having obliteration of her cochleas, which would have made cochlear implantation later impossible. That was why we operated on Neave at 3 months.
So when we had Neave switch on, it was incredible. She just loved it. She smiled, she loved the sound of her own voice. It was like this new awareness. She was responding to our voices. It was just out of this world. It was incredible. Today, Neave is 2.5 and she is just thriving. She is leading that normal life that I was so scared had been taken from her, and she is running and climbing and chatting and singing and dancing and just loving life. She's going to a mainstream school. She is just wonderful, and we are so blessed. So for new parents, have your child screened at birth for their hearing. It's the right thing to do, and it has the potential to really change your child's life and, like Neave, lead a completely normal life.